Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us again for our weekly press conference on Delaware's response to COVID-19. We're back again. Last week, we had our Facebook Live town hall meeting in the evening on last Tuesday. We had a different crew. We've got the band back together again. Dr. Carol Rattay is the Director of Division of Health. AJ Shaw is the Director of our Delaware Emergency Management Agency. And we have Pam, who's our sign language expert for the deaf and hard of hearing. Thank you all for joining us once again. Before we get into COVID-19 update, I'd like to just recognize and congratulate Dr. Rattay for being recognized with a special award earlier today by the Delaware Healthy Mothers and Infants Coalition, working on infant mortality in our state and doing so for so many years and effectively bringing those infant mortality rates down. Still very focused on the difference between women of color and the general population, but really addressing the social determinants of health. We've learned a lot about those, frankly, Dr. Rattay, over the last year with the onslaught of COVID-19. We appreciate your award was for being the longest serving public health official in the state. I think more importantly, you've been the leading public health official in our state for the past year during this very difficult and challenging time. And so we certainly appreciate the expertise that you bring to the decisions that we make, the leadership that you provide, your attention and your compassion, your attention to all communities, particularly communities, vulnerable communities, and just the professionalism that you bring in translating sometimes challenging public health and science information to our laymen and women like myself. We appreciate all your good work. Today, we're going to talk a little bit about our COVID-19 virus spread in Delaware, give you a little data update as we do each week. We'll report on our vaccination progress, another big weekend for AJ Shaw and his team at Dover Downs Speedway. With almost 15,000 dose of vaccines delivered in people's arms at that clinic and a number of other clinics over the weekend and through the week. Our partners in the pharmacies, hospitals, other healthcare providers are also stepping up to the plate and doing a really good job getting vaccines into people's arms. Our supply continues to increase, although we do have some news about the J&J vaccine, a pause that's underway now, ordered by the FDA and the CDC. Dr. Rattay will talk about that. Hopefully it's just for a short period of time so we can get those vaccines for one dose and done, vaccines flowing into people's arms. Some rare occasions of unexpected conditions with respect to blood clots that have been identified and 6 people that received the vaccine out of 6 million, so very small number, and the utmost of caution being taken by the CDC and the FDA. So with that, let's go to the data update. Thank you again for joining us. We are, as we have been really for the last month, in a mini surge, if you will, an increase in new positive cases on a 7-day moving average. You can see there, we're over 300 again, just slightly 331. We had trended down to around 200, under 200, and we're on our way to really greener pastures, hopefully below 100. We continue to test. It's dropping off a little bit. AJ, you'll report on that, but still, 30 some thousand a week, which is again more than we expected to do. Back when we started this in March and April of last year. The percent positive now above 5%. That 5% threshold is the World Health Organization target, so that's concerning. Again, still fairly high number of tests being administered across the state, but not as many as we've been doing. Hospitalizations is pretty flat. It's ticked up. We'll show a graph in a minute of that, and sadly, again, still additional lives, although very few as we move forward. And so let's look at the new positive cases. You can see the surge that we've been experiencing since Thanksgiving through the December holidays into the new year. And then with this recent uptick in cases starting about a month ago in early March, mostly as people started to, I think, relax from the holidays. Weather started getting nicer. People were moving outside, not as compliant with face mask wearing and with respect to social distancing. I do see pretty good compliance though. We had our weekly conference call with the mayors of the towns and cities across our state, and they continue to see pretty good compliance. The beach communities, again, there are a lot of folks that want to take their masks off and only put them on when approached by local town police officers. And so we just encourage people to continue to follow the mask mandate, particularly when you're inside. Much higher risk for inside venues, required that people wear masks. Outside, much less riskier, but you need to be careful with social distancing, making sure you're keeping separate from those people around you. It's always safe to have a mask with you. In Rehoboth in particular, it's required because of the density of folks walking up and down Rehoboth Avenue and on the boardwalk. I believe they do allow you to take your mask off once you get situated on the beach. Hopefully we'll be able to loosen that up as we move through the spring and into the summer. But we're only going to be able to do that if we're able to start to push those new cases on a day-to-day basis down, reduce hospitalizations, and get the surging virus a little bit more under control. So let's take a look at the current hospitalizations there. You see the same kind of graph with the surge in hospitalizations last spring. And then the better months during the summer, the run up in late October and November, the December holidays, then the decline in February and March, and then this most recent mini surge, if you will. Other states across the country are seeing it in a worse way than we are here in Delaware. And so we need to lean into this to make sure that we can flatten this out and get to a better place. On the vaccination side, we're really making tremendous progress, almost 600,000 doses administered, 552,000 doses delivered to the state, another 152 directly to the pharmacies. So so you're clear, we have doses that come and are allocated directly to the state of Delaware. We allocate those to curative clinics at the Deltech campuses in Wilmington, Dover, and Georgetown. We allocate those to hospital and physician providers. We allocate those to our pharmacy partners and to individual community clinics that we've been doing through the Division of Public Health and their outreach. And then another 152,000 doses are allocated directly from the federal government to the pharmacies. And so you're seeing the supply at the pharmacies increase and the availability of appointments to get vaccinated at your local pharmacy increasing as well. We have opened up our registration to everyone 16 and older. And so that has increased the demand for the vaccination appointments we had over the weekend, about 15,000. You see the number at the bottom, 126,000. Basically, those are vaccines that we've received and they're in transit to our partners. They're in our warehouse waiting for our weekend clinics. They're basically being that period of time between when they're shipped out to the federal government, they arrive in our warehouse, and then they're moved out to be vaccinated and put into your arms. So what's that progress look like? Over 38% of all Delawareans, that's the total state population. Remember that not all Delawareans are eligible to be vaccinated at this point. Youth and children 15 years and younger are not yet approved to receive the vaccine. So we have about 974,000 Delawareans. At 38% is the number of vaccinations delivered over the total population. About 750,000 are eligible. So if you do that calculation for seniors, we're at 83% of seniors are partly or fully vaccinated, meaning they've received at least one dose of a two-dose series or the one-dose Johnson & Johnson. Most of the seniors have gotten the two-dose vaccinations because they were the first population that we did before Johnson & Johnson one dose was available. It's about 2/3, almost 70% of seniors that have been fully vaccinated. And that's really a big achievement. And so of the remaining population, total population, 43% of those who are eligible, again, this is the 750,000 Delawareans that are eligible, 43%, closing in on 50%. And those are numbers that exceed the national average for states across the country. So we're really making progress there. We've seen strong demand, particularly as we've opened it up, registrations for everyone 16 and over. And now we're allowing all of our partners to provide vaccines to that 16 and older population. Previously, healthcare providers, physicians, and hospitals were doing Delawareans with pre-existing conditions. Now we're opening it up for them to do vaccinations as well for the general population. So if you need to get a vaccine and register, de.gov/getmyvaccine, or you can call our number if you don't have that internet access at 833-643-1715. Before I turn it over to Dr. Rattay, I want to really thank all our partners. I mentioned most of them, the pharmacies in particular, doing a really good job getting shots in people's arms. Lots of partners running our clinic at Dover Downs, where we did 15,000 vaccinations over the weekend. AJ Shaw and his team, paramedics from the 3 counties. We had EMTs that were getting their certifications, were supervised by public health officials there this weekend. Our whole public health team just really doing an outstanding job. The Delaware Army and Air National Guard, hats off to those men and women doing a tremendous job at the Speedway. Our partners at Curative and Vault for the clinics that they're running, our community outreach team and their efforts to make sure that communities of color and vulnerable populations get access to life-saving vaccines. All of our partners, and you can see some of those volunteering at the various clinics at DMVs and at Dover Downs Speedway. We appreciate their tremendous work. And with that, again, our award-winning Director of the Division of Public Health, Dr. Carol Rattay.
Great, thank you so much, Governor. So let's move into, as always, starting with a discussion about our areas of concern. As the governor mentioned, as far as our cases and our overall COVID situation, we're relatively stable at this point in time. We still have higher levels of cases in our state and communities than we would like to see. The zip codes that meet our criteria for areas of concern spiked dramatically last week to 23. And so this week it dropped slightly to 19, which is still more than we had been seeing through most of March. The areas that meet the criteria, the zip codes that meet the criteria, are all in Newcastle and Kent counties this week, and include 7 Wilmington area zip codes, 3 Newark zip codes, Newcastle, Bear, Middletown, Smyrna, Cheswell, Dover, Camden, Wyoming, Magnolia, and Felton. So again, we're really seeing higher levels through much of Newcastle and Kent County, not as much in Sussex County at this point. Let's talk a little bit about the big news of the day nationally on the vaccine front, which is related to the Johnson & Johnson vaccine. The FDA this morning, as the governor mentioned, recommended a pause in the Johnson & Johnson administration based on 6 cases of blood clots nationwide in women aged 18 to 48 who had recently received the Johnson & Johnson vaccine. Now, This has been described as an extremely rare effect. So only 6 cases out of 6.8 million administrations in our country. And the FDA acting director this morning described the purpose of the pause as alerting the public and the medical community to the potential effect, since it requires a different type of medical treatment than a usual blood clot. So it's really important that, first of all, that the FDA and the CDC have a better understanding about these 6 cases, but also so that the medical community is aware of how to identify these cases and how to treat it. For those who have received the Johnson & Johnson vaccine, please, again, understand this effect is extremely rare. The range is essentially 1 in a million. And the symptoms of these rare, they're calling them CVST events, they're not the expected vaccine side effects. So with all 3 of our vaccines, including Johnson & Johnson, we are commonly seeing whether it's soreness at the site or kind of some flu-like symptoms like fever, nausea in the day or 2 after vaccination. These events are not the same. So we want to make sure that those who have experienced those like flu-like symptoms right after the vaccine, don't worry about that. That's to be expected. In these cases, these symptoms, more serious symptoms, were found 6 to 13 days after the vaccination. And what is experienced with these more severe blood clots is very severe headache, severe abdominal pain, severe leg pain, and shortness of breath, which is an important symptom of this. And it occurs essentially between 1 to 2 weeks, so 6 to 13 days after. Nothing has been seen after 3 weeks after vaccination. So those who have received their Johnson & Johnson vaccine weeks ago should not at all be concerned. Anybody who experiences these symptoms should contact their medical provider and talk to them about the symptoms they're seeing. It is important to mention that these symptoms have not been seen with the other vaccine types, the Pfizer or the Moderna per FDA at this point. And of course, there have been many more administrations of those vaccines over the past few months. So while currently the Johnson & Johnson administrations are on pause, we want to remind you that if you have an appointment for Pfizer or Moderna, make sure that you do keep it. As we know, one of the constants of this pandemic has been the constant surprises, and often these are unfortunate ones. With the Johnson & Johnson in the last few days, in addition to these 6 events that are being monitored, we also saw a significant drop in our expected shipments. And so, this is, we had already adjusted our vaccination events based on the fact that we were not going to be getting much Johnson & Johnson in the coming weeks. Some people may see cancellation of appointments by pharmacies, as pharmacies are the ones who have a lot of the Johnson & Johnson at this point. If the pharmacies have supply of other vaccine types, they may be able to switch your vaccine type so you can keep the appointment. That may not be the case at all times. And although we will try to supplement pharmacies with Pfizer or Moderna, we don't have enough supply to fully supplement this any shortage at this point. So there may be some cancellations, but again, just stay patient. More vaccine is getting distributed all of the time. And not having J&J to administer will impact our ability to carry out plans for the larger vaccination events through the month. We had planned to use the Dover International Speedway for Johnson & Johnson events. So for those on the waiting list, we will likely be sending out fewer invitations in the next week, as most of our large events planned at Dover International Speedway will be for second doses. But stay tuned, because certainly more invitations are headed out there, especially for those who are on the waiting list. All right, let me switch gears to talk about variants. That's something we talked about at our last press briefing. We continue to look for and find an increase, just like the rest of the nation, of some of the COVID-19 variants here in our state. Now, of the variants of concern, the UK variant continues to be found in our surveillance sampling. So we're now up to 64 cases of the UK variant, and among the variants of interest that we've been tracking, we're up to 65 cases of the New York variant. Now, I want to note that this is certainly not the number of variant cases that we have in Delaware. We are sampling just a small percentage of positive cases in our state, in our public health lab, and some other partners are sequencing as well. So this is not going to be the total number of variants in our state. What I think is helpful to see is, of the positive cases that we are sequencing, that percent of the total is increased. So overall, of the 1,426 samples tested in our public health lab, 9% are positive for a variant. But when you look at the last week, of the 89 samples we sequenced, 36% of them turned out to be variant strains. So you can see the percent of our tested positive specimen is higher than it was previously. But again, this is just a sample of the cases in Delaware. We aren't able to sequence all of the positive cases, but it does certainly tell you that we have the variants in our state. I would remind you, though, that the vaccinations that we have available do protect against these variant strains. So this does provide an extra incentive to be vaccinated. On the next slide, I want to touch on breakthrough cases. This isn't something that we've really talked a lot about, but these vaccines are great. These vaccines are very effective, but no vaccine is 100%. So again, they're very effective, and certainly in providing protection in our families, our schools, and communities. But we do have some breakthrough cases. We've seen 70 breakthrough cases in Delaware where someone tests positive after being fully vaccinated and after the vaccine has become fully effective. So that would be 2 weeks after the second dose of Moderna and Pfizer, or 2 weeks after a single Johnson & Johnson vaccine. Now, for the most part, what CDC science is telling us, that those who have a breakthrough case after being fully vaccinated have a milder case. However, you do see some more serious cases. So 3 of our 70 breakthrough cases were hospitalized. And of those 3, unfortunately, 1 individual did pass away. Dr. Fauci mentioned last week that there have been some deaths around the country among breakthrough cases. And this is predominantly occurring among elderly individuals and those with underlying conditions who might not have been able to develop as strong of an immune response. Dr. Fauci indicated that the number of individuals who were breakthrough cases is still compatible with over 90% vaccine efficacy identified in the clinical trials. So while it is significantly less likely, it is still possible to contract the virus after being vaccinated. And the possibility of infection and potential for transmission is why we continue to remind Delawareans, especially while we still have a relatively high amount of infection in the community, to continue with public health precautions like wearing masks in public. It continues to be the most important prevention measure, even after receiving the vaccine, and until we have been able to get more people vaccinated and to decrease the number of cases more. I just want to close with a couple more little reminders before I turn it back to the governor. Well, vaccine eligibility has now been opened up to all individuals 16 and older at state events and pharmacies, and now medical providers. We really want to remind people, parents, individuals themselves who are 16 or 17, there's only one vaccine type that you are eligible for, which is the Pfizer vaccine. So think P is for pediatrics. Pfizer vaccine is the only one that 16 and 17-year-olds can get. Moderna and Johnson & Johnson are only approved for those 18 and older. So unfortunately, because in some of the sign-up lists, even though it says for Pfizer and Johnson & Johnson, or I'm sorry, for Moderna and Johnson & Johnson that you must be 18 and older, we have had people get signed up, and we try to uninvite them if they are a minor. But there have been people who have shown up for appointments and have been turned away. So we just want people to keep that in mind. The other thing, just want to give people a reminder who have traveled in the last week. CDC just put out a great study in the last week, really showing that these mitigation strategies around travel that we talked about a few weeks ago really make a difference in decreasing virus spread. So if you did travel last week, please be safe and get tested 3 to 5 days after you return. And that's especially the case if you've traveled to a place where there's higher levels of the virus. But, even if you haven't, if you were dining indoors or at any, social types of events, or certainly with crowds, or flying in an airplane, make sure that you do get tested so that just in case you're positive, you can prevent spreading it to others. And with that, I am done, and I'm going to hand it back to you, Governor.
Thank you very much, Dr. Tay. Some really important and helpful information, starting with making sure you get tested when you return from a trip where you've flown somewhere. Be careful when you're visiting in other states, particularly states with increasing cases, and there are a number of states that fit that category. These mitigation efforts that we've been talking about for almost the last year continue to be important till we get this thing under control. We are seeing the appearance of some of the variants. We expect that the transmission occurs greatly with respect to the variants. The utmost caution of the FDA and the CDC with respect to the Johnson & Johnson vaccine, the brief pause there. Hopefully we'll get back to that pretty quickly. Some of the breakthrough cases, just because you're vaccinated doesn't mean you're 100% bulletproof, like any other vaccine, like the flu vaccine, vaccines we have every year. These vaccines are much more effective and efficacious than flu vaccines, but still there are some breakthrough cases that you need to be mindful of. Bottom line is, we're still in this. We're seeing the light at the end of the tunnel. We get more and more people getting vaccinated to make sure that you get your appointment. Hopefully we'll get back to J&J supply pretty soon, and get tested as well, just to help us with those numbers. AJ Shaw has been running point on both our testing operation as well as the vaccination team with the Doctors Rick, Division of Public Health, Rick Kong in particular. AJ, give us an update on testing and the vaccination clinics.
No, so definitely start off with testing. And I think Dr. Tate, hit upon some of the concerns we have throughout the state. But again, a strong week with testing, but unfortunately, the numbers are going down. So we do know with a large percentage of people that at least have one shot. We figured there would be a decrease in testing. However, with spring break and people traveling, in the increase of the positive rate, it's important to keep getting tested when you are in situations where you could potentially spread others. So we did see a drop from 37 to 33,000 last week. We still have ample opportunities. We haven't scaled back the locations where we're testing or the number of events we have a week. So go out to de.gov/get tested to look at what's in your neighborhood to get tested this week. I know a lot of schools are really helping us get the word out there. We have a partner that goes to different schools over the course of the month to do it on site with the consent from parents, et cetera. So there's ample opportunities out there. So moving on from testing, we'll talk about vaccination a little bit this weekend and give a recap. And well, like we said, we were only a few hundred doses away from breaking 15,000, which would have been very exciting. But kudos to all the people that have worked, worked 6 sites from Friday through Sunday. We had 3 sites up in Newcastle County. The Speedway, under the direction of Diane Hainsworth and others, was operational both Saturday and Sunday, as well as some smaller events down in Sussex County. And these are just the ones that the state was really the muscle behind with our partners, whether it was Public Health, National Guard, Medical Reserve Corps, Fire, School, or others. I mean, we know there was pharmacies. We know Bay Health was doing something down in Dover as well. So there are, when I say dozens, really dozens of opportunities across the state for people to get vaccinated through your employers or church, organizations you're with. So please take advantage of it. And we know signing up is that first step to help get you on our radar to send you out an email. Make sure you know when an event around you is going to happen and get you signed up for it. Kind of the other exciting thing this weekend was about a month ago, we knew sooner or later we were going to hit a time where we've tapped into just about every vaccinating individual that was licensed to do so. So Dr. Rattay, signed an order to allow EMTs, so those that work for the fire companies and the hospitals across the state, to administer vaccines on site as long as there's somebody of higher medical authority there, a doctor, nurse, et cetera. So we reached out to the Delaware State Fire School, good partners, utilized some of their EMTs to get trained Friday, and then they ran an event up in Claymont on Saturday with the assistance of the National Guard and vaccinated just 1,200 people. So again, just gives us another tool in our toolbox to assist as we still have a steep hill ahead of us to get to the herd immunity and over 1 million vaccinations to give in the state. Then finally, before turning back over to the governor, kind of a somber note, but hopefully this is something that could assist families that may be going through a rough time. One of the benefits that the Federal Emergency Management Agency rolls out after disasters that we've seen in the past is really a funeral assistance program, which will help with the burial expenses of a loved one that passed because of a disaster. So normally you'll see this after hurricanes or other natural types of disasters. Well, they turned that program on for COVID as well. It went live yesterday for people to start applying for it. It is only done by phone due to the sensitivity of the information and having to have the dialogue with the individuals. We do have a team that will work with our federal partners on any follow-up that's needed to validate something or get a copy of a death certificate, et cetera. But, the 800 numbers here, 844-684-6333. Again, it's something, hopefully it helps people as they're going through the recovery themselves, if it's something that could be of assistance on the financial burden as well. But anybody that's living in Delaware that paid for funeral expenses of somebody that died because of COVID can apply. There's still other parameters that FEMA will discuss with you. But again, we'll post that on our website as well so people have that information. But we know there's been a lot of interest in that, and hopefully it could assist people as we're coming out of COVID. So with that, sir, I'm going to turn it back over to you.
Thank you very much, AJ, and thank you to your tremendous team there and all the partners, particularly our Army and Air National Guard, local paramedics, everybody, the Reserve Corps, Medical Reserve Corps, our Lieutenant Governor out there working all the sites. Before we move to questions, we do have a little bit of a commercial here for our friend Big Ivan Thomas. The COVID conversation tomorrow, April 14th, 6 p.m. In English, 6:30. In Spanish, a conversation with Wanda Barrett from United Way and Chad Robinson, doing a great job with the Food Bank of Delaware. Watch DETV Live, Big Ivan Thomas with DETV, and the COVID conversation tomorrow, April 14th. We have meetings, media once again have joined us, and I'm sure they have questions. Again, today we're making real progress with our vaccination program here, moving on 50% of the population, total population in our state, 50% of the eligible population getting vaccinated, opened up to everyone that's eligible, 16-year-olds and over, significant penetration in the most vulnerable senior citizens, 83% with at least one dose, and over 2/3 fully vaccinated. Continue to make progress in that area. So we would invite any questions that you have at this point in time.
All right, first we'll go to Nick Ciolino from Delaware Public Media.
Good afternoon, everyone. Dr. Rattay mentioned earlier that there were going to be some potential cancellations and a limited number of invites to Dover International Speedway events. I'm curious how severely the pause on the J&J vaccine affects vaccine distribution locally, especially given that it's the only vaccine with one dose and given the state's limited time window for use at the Dover International Speedway.
Well, before I turn it over to Dr. Rattay, it all depends, certainly. We hope it's just a brief pause to take a look at these 6 very, very rare cases out of 6 million vaccines, a very insignificant percentages of those made. We know that the J&J one-dose vaccine was one that with great appeal for folks. It won't affect our clinic at Dover Downs because we didn't coming up this weekend because we didn't have any plans for it. So in the short term, it won't affect us. The pharmacy program is another matter there. And so some of those, we expect that some of those appointments will have to be canceled. They won't get the supply that they get directly from the federal government, but we're hoping that it's just a short delay with the utmost of caution, and then we'll be able to move forward ahead with that single dose Johnson & Johnson vaccine. Dr. Rattay, anything to add to that?
Not a lot. We'd already adjusted to the fact that we learned last week that we were getting much less Johnson & Johnson in the state than we had previously expected. And so we'd already adjusted to that. And additionally, AJ and the team have really been working on pivoting away from Dover International Speedway to more community events for vaccine distribution, in large part because NASCAR's coming up. And so our time is limited there anyhow. So it's not significant change from where we were headed anyhow. But as the governor mentioned, we certainly do hope that this pause is just a temporary safety check so that the Johnson & Johnson vaccine that is in state is vaccine that we are able to use again soon.
And then with the state's decision to open up vaccine eligibility to everyone over the age of 16, is there still an effort at hospitals, health systems, and other vaccine locations to prioritize people with pre-existing health conditions?
Yeah, well, we've encouraged all our partners to work through that prioritization list, but now we're basically saying, you can open it up to, distributing, administering a vaccine to the total 16 and over eligible population. So we want to thank, frankly, the physician offices, healthcare providers, our hospital partners for focusing on those with pre-existing health conditions, because that was something that they could do a lot better than us, knowing the conditions of those folks.
All right, next we'll go to Amy Cherry with WDEL.
Hi, everyone. Thanks so much. The number of Delawareans 16 plus who signed up for the state's waiting list was likely lower than expected, at least last check when I had a number last week. I'm wondering if you're attributing that at all to vaccine hesitancy and whether you're afraid that this J&J development will fuel more of that.
Yeah, so I don't know that we've done an analysis of that. We do know that the intensity for signing up on our waiting list was the greatest with the 65 and older. When we opened that up, we had 70,000 in half a day. And then when we opened it up for 50 and older, took a couple of days. We had, I think for 65 and older, we had like 75,000 sign up within a short period of time, one day, I believe. The next group was like 20,000 for the same period of time. It did tick up after that. And similarly, when we moved down to 16 and over. Part of that is because we were vaccinating some of those folks in those age categories as essential workers, as first responders, as people with pre-existing conditions, and folks that were able to work their way in line and get a vaccine. And so the level of intensity, and that's why we were incentivized to open it up more broadly sooner than what was required by President Biden and the federal White House task force. So we have been watching the intensity of that registration for our Dover Downs clinics. It also seems clear that people are able to find an appointment at their local pharmacy instead of driving, if they're way north or way south, an hour to Dover and back. So we have been monitoring that, try to match the opening, if you will, and the allocation with the intensity as measured by the sign up, the time for signing up and filling those slots. These 15,000 slots over the weekend, and AJ can comment, filled up pretty quickly as I understand it. AJ?
Yeah, so I think that they filled up and we didn't let any spots go to waste. However, kind of what the governor alluded to, we did see just the urgency is a little less than it was a month ago. And we can make the assumption that it's going to be a little less in 2 weeks from now than it is today. So we want to make sure that we're able to position our partners to be in the best available response posture to administer as quickly as possible. So when we were talking to our medical partners in the hospitals, if a doctor's office is getting a tray of 100 a week, they might only see a fraction of their patients a week that met the criteria for having medical conditions. And, so then they're leaving 80 doses on the table that week. So by letting us expand their universe, they're able to, while they're still having these touch points with the patients, able to administer it and just really be more efficient across the spectrum of vaccinations. So I think, just to kind of foreshadow a little bit, I also think we know the supply and demand curve is going to, invert here in the next few weeks. And we're working on opportunities to how do we get closer to the community and how do we make it a little bit easier for people that may not be hesitant, but maybe aren't as eager to take 2 hours out of their day on a Saturday to go someplace. So we're looking at a lot of options and we're not done yet. We'll put it that way.
And to that part of your question, we do expect that we're going to see that population with the hesitancy. And our hope is, and our messaging will be, as we move through this pause on the J&J distribution, is that'll create a level of confidence that it's safe, since they're investigating 6 cases out of 6 million, and we'll see what the result of that is. But we do expect, and we're conscious of hesitancy. We have some messaging that we're going to continue to push out there to try to address it, and that we expect that we'll see it as we move through the populations more motivated to get vaccinated.
Second question, we're seeing in some places across the country that younger persons are being hospitalized by COVID-19. I'm wondering if you can give us a more accurate picture or shed any light on who's being hospitalized by the virus here in Delaware.
Yeah, so Dr. Rattay could probably answer that better than I, but we do have our call with the hospitals this afternoon, and that's a question that we're able to find out directly from the hospitals. What are the people in their emergency rooms? What do they look like? What are their age groups? What's the demographic there? Is there anything we should be concerned about? So far, we haven't heard a lot of that. Dr. Rattay, anything you want to add to that?
Not a lot. At our last check, we heard from the hospitals that they were seeing some younger patients, so not as many of the senior citizens as before hospitalized, but we are looking forward to getting more information from them soon.
All right, next we'll go to Tim Mastro from Delaware State News.
Hi, everyone. Thanks for having me. This first part of this question might be hard to answer right now, but any idea how long this pause might last? Is it just in terms of an investigation? And then what should the pharmacies and providers who have Johnson & Johnson do? Are they just keeping them for now? Is there a chance they might be thrown out?
Yeah, it's really not clear. On the White House call, which we had just a couple hours ago, Dr. Walensky from the CDC mentioned that there wasn't any specific time frame. I can tell you that all the governors were eager for it to be short in duration and to get it done as quickly as possible so that we can continue to move shots into people's arms. Dr. Rattay, anything that you might?
Yeah, at this point, there's certainly no concern that vaccine will go wasted. They'll any pharmacy or other vaccine provider just needs to make sure they keep it stored safe at the appropriate temperatures, and it should be fine. But as the governor said, I think we're all hoping that the pause is a short one.
All right, and then one more question on testing. AJ, you mentioned that the sites are still pretty consistent, even though the numbers might be dropping. Is the demand still there for the at-home tests? Are those still rolling out?
They are not like they were back in the late fall, early winter, but we're still, it's still an option. It's on the website, where it gets FedEx to your house or overnighted to your house. You do it on Zoom with somebody and send it right back. So we're still doing, I'd say probably a few thousand of them a week. So not, we were probably doing a few thousand a day at one time in the late fall around the holidays. So that's drastically dropped as well, but that option is still out there.
AJ, do you want to comment on the University of Delaware? Because they really have been doing a good job in monitoring their students and faculty.
No, so I think if everybody remembers when they brought, I think, over 3,000 students back for the spring semester, they mandated testing twice a week when everybody got back, and they had several positives. People were coming back, and they identified multiple people. They utilized some empty residence hall rooms as well as hotels in the area to really isolate and quarantine individuals. And I'm going to knock on wood, but I think it's their education and their testing regime has really been instrumental in keeping them safe. And I'm not sure if Dr. Rattay has any specific information in the number of cases, but it was high for the first probably 10, 14 days they came back, but really just shows you that testing and education are both needed for mitigation, not just one dimensional.
Yeah, we still are seeing some spread among the college community, but it's certainly much lower than it was earlier in the semester.
All right, next we'll go to Brandon Holbeck with the News Journal.
Good afternoon. On the Johnson & Johnson front, there's 7 million or 6.8 million doses of it have been administered, and it's obviously a very, very low number of them are dealing with this blood clot side effect. Can you explain why this is so significant that it would lead to a shutdown of all of the distribution of the Johnson & Johnson vaccine, given what we know about how dangerous COVID is, how transmissible it is, and how transmissible these variants are? Why is this so significant to shut down the whole train of Johnson & Johnson vaccines?
Well, I can tell you that every governor wanted to have the same question because it did sound like a kind of de minimis, statistically insignificant number in the scheme of things. However, they've identified a problem. We need to better understand it from a science perspective so that we can move on with really kind of greater assurance that the vaccine is safe. We know that we've had breakthrough cases of people vaccinated that have been seriously ill. And I think we've had one fatality, somebody with a pre-existing condition and elderly for sure. So those things are going to happen. I don't think you can, the CDC and the FDA wasn't willing to chalk it off as that, but I can tell you that governors and states are eager to get going again. Dr. Rattay, any thoughts on that question?
Yeah, it is a great question. I think it does speak to the fact that, there is a real focus among the federal government to ensure vaccine safety. And so a short safety pause to better understand what's going on is not a bad thing. The other aspect of this is this type of blood clot is rare. And it's treated differently than a typical blood clot. Heparin is often used for blood clots, and it's not supposed to be used with this CVST. And therefore, a pause just to make sure that the healthcare community knows how to identify these issues and how to treat these issues certainly makes sense, and also making sure that the public is aware, even though it's rare because it can be serious. It's helpful for doctors and the public to know what's going on.
And it could create greater confidence by being transparent about it, stopping and looking at it, because we don't want to have the effect that Amy Cherry's question alluded to, which is greater hesitancy. So if we can create greater level of confidence, we've looked into this, here's what the explanation is, we can move on with a greater level of acceptance, recognizing that up to this point, there's been a lot of demand for the one-dose J&J vaccination.
My second question goes toward the idea of breakthrough cases. Can you explain how people should interpret the numbers that kind of get assigned to these vaccines in terms of effectiveness? Like, you often read 94% effective or 95% effective, but I imagine it's a little more complex than just if you're exposed 100 times, you'll be safe 95 times. So how does that kind of work? And it seems like the breakthrough case results would kind of match with what you saw in clinical trials as far as how effective the vaccines have been.
Yeah, that's a great question, Brandon. And so those numbers that we use, they are based on the clinical trials. And so in the clinical trials, you're comparing a large group of people who've gotten the vaccine to a large group of people who have not gotten the vaccine. And so, with these vaccines, we saw that through those clinical trials, that they were very effective in decreasing your likelihood of getting COVID-19 compared to people who didn't get the vaccine. So that's what the numbers come from that we use. Now, you may have seen that recently there were some Pfizer trials, or not trials, but studies released that are really based on real world. So the more and more these vaccines are out there, and the more and more we're studying them, those numbers may change just based on the number of people who are getting the vaccine. But breakthrough cases are to be expected. Even, these vaccines that are 94% effective, that means, some people are still going to become infected if they're exposed to the vaccine. I'm sorry, if they're exposed to the virus. And again, that may be because their own immune system didn't respond well to the vaccine, if they're elderly or are immunosuppressed for some reason. But it also could be a combination of maybe an underlying condition plus a heavy exposure if they were closely around somebody who was infectious.
All right, next we'll go to Mallory Metzner with WRDE.
Hello, yeah. Just to reiterate, so there is no concern right now for a delay in vaccine distribution in Delaware. Is everything still going to roll out as usual once we move through this pause in J&J?
Yeah, I wouldn't say there are no concerns. Obviously, it won't affect the state clinics over the next week, but there are several thousand J&J vaccines that were coming to the state directly to the pharmacies. And so it's our expectation that those appointments will have to be canceled. So that affects people, ordinary folk. They don't differentiate between the state allocation and the pharmacy allocation. They just know that they have an appointment at a given pharmacy that's going to be canceled. And we're going to see some of that. With respect to our clinics, though, we're basically doing mostly second dose Pfizer and Moderna vaccinations at the venues that we're working. Now, if it goes on beyond that, then it will have a larger impact on our operations and continued impact on the pharmacies. In the long term, J&J is an important part of our distribution effort, and obviously will mean we'll have fewer people vaccinated faster.
Okay, so as the state opens up to everyone 16 and older, there's no concern in a shortage now that J&J is on hold.
Well, we're still in a scarcity situation, as AJ alluded to earlier in answer to one of the questions. We're, in a couple of weeks, that supply and demand thing's going to turn upside down. We think we can feel it coming, and so and then you'll have the hesitancy question that's out there. So yeah, we're going to have less supply, and that's a concern, but it doesn't come at a time where the demand is as intense and as we're open to all Delawareans who are eligible to be vaccinated. Is it a concern? Yes. Could it be worse? It could, but we're going to manage it, and if it's a brief pause, then we should be able to get through at least the state side of it, not impacted as dramatically as it could have been.
All right, next we'll move to our pre-submitted questions. The first question's from Laura Walter at Coastal Point. She asks, if the Delaware website says we've had 98,000 cases, should we assume that this equals about 98,000 different people? Or does that number include any repeats, like someone who maybe tested positive twice in the same week?
Dr. Rattay.
Yeah, it's a great question. So our system that collects information about cases is collecting information about individual people. So that's 98,000 people who have tested positive for COVID in our state, which is about 10% of our population.
And the second question, similar from Laura Walter at Coastal Point, do you have any idea of how many Delawareans might have had COVID twice, and would they therefore be counted twice in that number?
Yeah, so we are making adjustments to our system to more formally be able to collect that information. But at this point, we think it's less than a handful of individuals. So perhaps 5 or less individuals who've actually been reinfected in our state.
We have a question from Randall Chase at AP. Are you considering tightening back down with COVID-19 restrictions on business operations, schools, and gatherings, given that Delaware is among the states with the highest case increases per 100,000 over the past 7 days?
Well, I hope we don't have to tighten down restrictions again. And we've kind of leveled off a little bit with respect to hospitalizations, new positive cases on a 7-day moving average. So hopefully this is the beginning of a downturn there. Obviously, we've got warmer weather coming, more focus on outdoor activities. That will open up restaurants to outdoor dining, which we've heard was very effective last spring and summer. And we know from talking to the mayors this morning and last week that their proprietors in their towns are excited about that. So no, the hope is that we'll continue to see a downturn in cases, hospitalizations, and percent positive, and be able to reduce restrictions. If things get worse, we'll have to take that as it comes.
All right, this is the last question. We got this in the comments on our live stream today. Someone asked, Governor, when you would consider removing restrictions on school bus and classroom capacity.
Well, we're already operating with a 3-foot social distancing requirement in the schools and have been for some time. We've got about 80,000 of our students doing some level of in-person instruction in districts across our state, moving towards what we hope to be 100% of our students for in-person instruction starting in the fall. We got to get healthier. We've got to flatten this curve and see cases declining, and we'll continue to push for that. Expect that we'll continue on the course that we're going now for most of the end of this year. I'm mostly focused on making sure that school districts, our Department of Education, are really laser focused on making sure that every child has every opportunity to accelerate their learning over the next several months, over the summer school and summer programming, and into extended day programs full next year. Department of Education has come out with what I think is a really good high-level plan. We just need to operationalize it and have each of the districts provide leadership in their particular area. We need to provide information to parents so that they know the resources that are available to their children so that they can make up for lost learning over the last year. There will be assessments as required by the federal government, where we'll be able to tell where individual students are in their academic progression so that we can meet their needs during summer school and extra time next year. That is one of the biggest challenges that we face as a state in an area where I am particularly focused, along with the Secretary Bunting, her team at DOE, and I know all the superintendents and their staff in the school districts. I think you said that was the last question. So again, I want to thank everybody for attending today, for tuning in, if you will. More than ever, we need to act with a sense of community, follow the rules, wear a mask, wear a mask, wear a mask. That's the most important thing you can do. Be conscious of your social distancing. It's a lot riskier indoors than out of doors. Make sure you're wearing a mask, paying attention to who's around you and your surroundings. Enjoy the nice weather outside, beautiful open spaces here in our state, and we'll see you next time.